Hello, dentalunboxing.com subscriber. It's Dr. Tim Kosinski again, one of the clinical evaluators with dentalunboxing.com. Thank you for joining me today for another dental product unboxing and clinical evaluation. Let's get to it. Today, I'm unboxing and going to clinically evaluate in my practice a product from GoldenDent located in Detroit, Michigan called the GoldOss Allograft, which is a particulate bone graft for bone grafting procedures. Allograft material, as you know, is from a human source. It's very, very controlled, and this is a very high quality material that we use for our grafting or bone building procedures routinely in our practice. So let's open the box. Let's see what's inside. So what do we have? Let's see. A lot of different materials in here. So this is how the material is going to be presented to you. We have material. Allograft again is human bone, and you can see that it's mineralized, demineralized material. They have different consistencies, different sizes, different shapes, and different volumes. The larger amount of material that you purchase, the less expensive it is. So you may want to use a larger volume for extraction sites that are larger. Here we have GoldOss mineralized cortical cancellous particulate, 250 to 1,000 microns. That's my favorite material. This is my go-to material. And this is a 0.25 cc container. So you have some variability on what you want to present. Again, here's a half cc, and let's open one of these so that you can see what they look like. As you open the box, it's going to come packaged like this. And it's always a little challenge to undo it. You'll simply open, and then you'll get a secondary package that you'll have to have scissors to remove. We'll take a pair of scissors and open up the material. I want to show you what the particulate looks like. Now you can scan the labels into your digital files so that you know what material was placed at what time. And again, it's self-contained, and it's a particulate material. And you will, before you use it, we will wet this material with sterile water or sterile saline. We don't use anesthetic. Anesthetic is very acidic. It will affect the turnover of this material. Now, because it's human bone, we will get some osteoconduction with the material. It will serve as a matrix. Osteoclasts will invade. Osteoblasts will lay down new bone over a period of time. Now, it's imperative when we're using an allograft material that we protect that graft from invagination of epithelium with some type of membrane. We need to protect that graft from invagination of epithelium for at least 6 weeks. So we're going to use a high quality membrane or band-aid or barrier to protect that graft from invagination of epithelium. We also have a putty material, and a putty material is again our allograft material in a matrix which allows us to inject it into a site. It's a very, very convenient way. It's a very convenient way of distributing the material. It comes in a syringe. So for those of you who don't want to physically mix the material, it comes in a syringe. You'll simply uncork it, and you can simply syringe the material into the socket site. So another very, very convenient way for you to do socket preservation and even to build a facial wall if you needed to. So again, high quality product. I am very excited to clinically evaluate this product and document it for you in my practice for dentalunboxing.com. Allograft comes in a particulate. Again, it's a mixture of mineralized cortical cortical bone and cancellous bone. It's like a powder, usually 250 to 1,000 microns, and it's a dry powder. We can wet it with sterile saline or sterile water, and it will kind of form a gel, which allows us to carry it to the site. You can buy it in different sizes, a half a cc or a full cc or even more. It works very, very well, especially when we have a facial wall that's missing. There's also allograft that's packaged already as a putty material, so it has a collagen binding material there, and it's in a syringe, so it makes it very easy to take this cortical cancellous bone and just inject it into a socket site. So if it's something that is more convenient for you, you may find this. Hi, dentalunboxing.com subscribers. This is Dr. Tim Kosinski, and I've completed my clinical evaluation of the GoldOss Allograft from GoldenDent. This evaluation took a little bit longer than others, and I wanted to evaluate the healing on several patients several months after placement of the graft. But let's summarize 5 main factors that I considered. The product saved me time. Well, it's an allograft material. It's packaged beautifully in half cc, 1 cc, and 2 cc vials, similar to other allograft or human bone products that we've used in the past. So I would say it's a time saver in that when we're removing teeth, I'm a big believer, because I place so many implants, that we need to preserve the socket from bone loss over time. We know that when we remove a tooth, bone is going to shrink down and in the lower jaw, up and in the upper jaw. So maintaining that hard tissue is very, very important to me. So it's very similar to other allograft materials that we used, packaged very nice. What's the simplicity or difficulty to integrate in my practice? I think it's not a difficult thing, especially if you're using different allograft materials today. I think it's a simple product to replace other allograft materials you have. Remember that whenever we place an allograft, we must protect it from invagination of epithelium. Epithelium grows about 10 times faster than hard tissue. An allograft material will heal from the apex of the socket to the crestal portion of the socket. Epithelium will want to grow into the socket, so we must protect it with some type of barrier or membrane. And there's different products you can use, and this product is no different than any of the other allograft materials out there. So I would say it's as simple as other allograft materials. A product cost, that's the big savings. I think it's a high quality product and with a significant savings compared to other brands out there. I think that the research with the material and where they are harvesting the material is second to none. So you're getting a premium material at a reasonable cost. So I think it's very reasonable. How does it compare to current techniques? Well, the technique is the same with other allograft materials. We remove the tooth, we curette the socket, eliminate granulation, no purple blood. I pack the material firmly, but I don't crush the material. I like the 250 to 1,000 micron irregular shaped product that we have. And if I'm going to place an implant, I can thread into it, or I can place a membrane or a barrier and protect it from invagination. However, uniquely, I did come back after 4 months and evaluate, and we did get excellent turnover of hard tissue. The allograft was replaced with the patient's own bone in a very, very short amount of time. So when I purchased this product, absolutely. The savings that I can get in buying a high quality premium product, I can certainly pass on to my patients. So overall, I'd give the GoldOss Allograft, our dentalunboxing.com golden tooth, and would highly recommend it to any of my colleagues based on my clinical evaluation. And again, thank you for watching today, and please hit the subscribe button to get notification on any future product reviews and videos that we've done. Thank you.